Hey everybody, so here we are in our Unit 2 project in veterinary science called Case Study. So this is a project I'm excited about because it kind of lets you play doctor a little bit, veterinarian here. So as you take a look here, it gives you what I call a case study or like a hypothetical for a typical case that could walk in your door. So it says Max is a 7-year-old male golden retriever who was brought to the veterinary clinic showing concerning symptoms. The owner reports that Max has been drinking excessive amounts of water for the past 2 weeks, urinating frequently, and showing a decreased appetite. He appears lethargic and has lost approximately 8 pounds in the last month. Physical examination reveals slight dehydration despite increased water intake, and his coat appears dull. His temperature is 101.8 degrees Fahrenheit, which is within the normal range. It also is going to give you some results in our laboratory. So say you ran full blood work and you did a urinalysis, here are the results. It's also going to show you the normal range because I don't expect you at this point to have those normals in your head. But it's something in the future that may interest you. So our glucose is 385, BUN 28, creatinine 1.8, potassium 3.8, and ALT is 85. What I'm not going to tell you is what each of those mean. So that is something you're going to want to do some research on. Urinalysis. Color of the urine is pale yellow. Specific gravity is 1.020, or in vet world we call it 1020. Glucose is 3+, ketones 1+, and protein 1+. Once again, I'm not going to tell you what those mean. That is your prerogative in this project. So, student tasks. You have 5 tasks with this case study. So, number 1, based on the symptoms and laboratory results, what is your preliminary diagnosis for Max? Explain your reasoning. So, before you get nervous, let's flip back to our common diagnoses page. Take a look here of things that are common in the vet world, happen often. I'm not saying the answers here. It might be, it might not be. But things to keep in mind or to rule out as you go through this case study. Different types of diagnostics. So we talked about our blood test, right? We gave you like a snapshot of certain blood values. This is a good overview explanation of those. So hint, hint, take a peek, see there. Urinalysis as well. Okay. And as you go through the next question, list 3 additional diagnostic tests you would recommend to confirm your diagnosis. So you're like, I think this is it. What do we need to do, right? So go back to the diagnostic page. What will help you, do you think, in determining what is wrong with Max? Do we need to send out a fecal? Do some blood pressure, x-rays, ultrasound, CT scan? What do you think? Okay. Number 3, develop a comprehensive treatment plan for Max, including both immediate and long-term care recommendations. So there's kind of a hint there as far as this is a short-term or long-term concern. Hint, hint. Okay. This is a place where you're going to need to go outside of our course to do some research. Say, my diagnosis is a foreign body, I don't know, and research treatment for foreign body. Okay, and let me know what you think that is. Number 4, what lifestyle modifications would you recommend to Max's owners? So, for this long-term health concern, what does Max need to do? Did the owners need to change his diet? Does he need to come back every month? Does he need a medication every day? Okay, so things to think of. And number 5, what potential complications should Max's owners be aware of if the condition is left untreated? So unfortunately, this is something that happens a lot, right? If it's your pet gets diagnosed with something big or long term, people are gonna ask, what's this look like? What if I don't treat? Is he going to be painful? Is he going to be fine? Will he recover without treatment? So, potential complications that owners should be aware of if they don't treat. Okay, so like I said, you get to play veterinarian here. Try to put together the puzzle pieces. Don't be disappointed if you don't get the right answer. That's okay, right? This is going to be kind of more of a effort-based graded project, but I still want you to do your best and see if you can find out what's wrong with Max. All right, thanks so much.